And they'll- and now you got to click on the box that says "Got it." So it'll go out to everybody. It'll be made available. So let me go right to you, Makara, first. If you could just introduce yourself.
Hi, I'm Makara Trusty. I am the chair of the GTAC EMS Education Committee.
And why don't you tell them what GTAC is in case there's anybody on here who may not know?
My goodness. Okay, it's the Governor's EMS and Trauma Advisory Council. And so I'm chairing the subcommittee that covers EMS education.
So Makara and I will kind of host this meeting today and try to keep things moving. But the real important people on this call will be George Hatch and Bill Seifarth. And why don't we go with you, Bill? You want to introduce yourself?
Sure. Thanks, Joe. So good afternoon, everyone. Bill Seifarth from the National Registry of EMTs, and also Mark Terry is also on here from the National Registry of EMTs. So glad to be here. Looking forward to the conversation and at providing some clarity as well as overcoming some misinformation on advanced placement. So looking forward to the conversation. Thanks for having us.
Thank you, Bill. George.
Hey, thanks, Joe. Thanks, Makara. I'm glad to see a lot of faces. I saw the list of folks that were joining this, and the good news is I know most everybody on here. So that's great news. I'm George Hatch. I'm the executive director for the Committee on Accreditation, and again, appreciate the opportunity to talk about advanced placement, which seems to be the hot topic. And then anything else that you guys have an interest in, we're happy to talk about that. So that's what I got, Joe.
Well, thank you. Thank you again to both of you for joining us today. And let me just say that we're going to talk mainly about advanced placement and eliminate any confusion or concerns about it from the CoA's position and from the registry and from the state here. And then we will hopefully we'll have some time for other questions if anybody has any. Everyone is on mute. So I guess, Makara, we'll just ask them to put their hands up first, and then we'll unmute that person. Is that how you want to handle this?
Yeah, that's fine. They can either ask questions in the chat, or if down on the bottom toolbar, you should see that pops up security, participants, polls, chat, share screen, blah, blah, blah. But there's also reactions, and there you can raise your hand. If you kind of hover over that, you can raise your hand. So if you have a question that you don't want to type into the chat or you'd rather ask, just raise your hand and I'll monitor the screens. We do. Jeff Lowe says hands in the air like we just don't care. And absolutely true. But I will have to scroll across because it looks like we have about 54 participants and it'll show across 3 different screens. So if I don't get to you, just be patient. I'm going to monitor from as best I can.
You should just have bigger screens, I'm assuming.
If you only knew. my husband's an IT guy. I have lots of screens.
I thought for sure. So, okay, why don't we go ahead and get started? As you know, in these challenging times with the reduction in the workforce, not just in EMS, but in healthcare, and there's a lot going on in Texas with Senate Bill 8 providing $21.7 million to recruit into the healthcare system, into the EMS system. And I'll just say that at this time, we're still working through all that. Hopefully we'll be able to announce some stuff about that in the near future. But one of the questions that continues to come up, if I expired and I want to get back into the system, or I'm a nurse, or I'm somewhere else in the healthcare system, how can I get into the system without starting as if I don't know anything at all? And that's where we come into this conversation on advanced placement within the program. As you all know, at the basic and the advanced EMT level, that's regulated by the state. The paramedic program is, I shouldn't say regulated. That's not. I always hate that word. It's coordinated by the state, and then the paramedic program is coordinated by CoAs. And then we all have agreed to use the National Registry as our testing mechanism. A lot of this hinges on a lot of different programs, and keeping in mind, no matter what we do, we also have the EMS Compact, which overarches everything and sets the standard in this country on what everyone's doing. And currently 21 states are using the compact. And we were the second state into this. But this all started back in, I guess I had a little gray, not quite as much, when we started talking about credentialing of paramedic programs and using National Registry. And in Texas, since 2013, we have required all the paramedic programs to be accredited in Texas. And currently today, we have 59 programs. We had 74 back in 2013, 2012 at that time. But it is exciting to know that from a Texas standpoint, we test more people. We are the second highest state in the nation testing paramedics, which is kind of cool. We push a lot of people out into the industry. So let's talk a little bit about the advanced placement. And I think if it's all right, George, I'm going to start with you. And if you can just talk about the process, because we know it's a requirement to be an accredited program to have a process. And then we'll talk a little bit more about the basic and the state requirements, but they really are pretty similar. So let me kick the ball over to you there, George. Thank you.
Okay, thanks, Joe. So let's talk about what advanced placement is, and then we'll talk about what we can do with that and what it's not. But I want to start with sort of the end in mind, and this is a concept. Advanced placement, for those of you that are in academia, in colleges, technical colleges, and universities, you have an advanced placement policy. And in fact, this is a policy that is regulated. The term advanced placement is a registered term that was developed by the American Council on Education and the College Board. Okay, and I think what's important about this, for those of you, again, in colleges and universities, is 99% of all of colleges and universities across the United States have an advanced placement policy. Okay, so this is not something new. It's maybe new to us kind of thinking about it, particularly if I'm a fire department or I'm an EMS agency or I'm a hospital, someplace where education is not in a college setting. But the College Board and the American Council on Education defines this as a rigorous college level class to earn credit. That's the definition of what advanced placement is. And they say that if you go through an advanced placement process and you take, let's say, I'm just going to make up something, but trauma emergencies. If they were to take trauma emergencies and you were going to use that for advanced placement, it should at a minimum probably be about 3 semester hours of college credit. Okay, that's their definition. Okay, and this is, again, widely used in academia. That's how they go about saying that if you score high enough on a particular, whatever that metric is, we're going to award advanced placement. Some of you that have kids in school, or maybe you've done this yourself, but I got a daughter that's graduating and she's got, 12 hours of either dual credit, or in some cases, she's got advanced placement. So when she goes to a university setting, she's going to be able to move over with that. So that's what advanced placement is defined as. I guess what I would say is the issue, I think, for most people is it's a lot of work. And the reason it's a lot of work is people are like, how does this fit into what we do? We actually have, Makar, if you can pull that up, I don't know, just pop it up there for purposes of illustration. We actually have an advanced placement policy. So if you go to the CoA MSP website and you click under accreditation, you'll find our policy and procedure manual. And if you go to page 53, you're going to notice that there's a pretty robust definition of what advanced placement, or what some folks call prior learning assessment, is. And so that's where it really gets down to the nitty gritty about what that is. So we've got a policy that's out there. What I want to talk about is that, you've got a lot of different possibilities here, whether I'm in the military, whether I have prior certification, whether I have some exam or psychomotor testing that's been done, or an assessment of my portfolio. Those are the 4 big pillars, I guess, of what that advanced placement or prior learning policy would look like. So let me start by saying we don't have a problem with you guys awarding prior learning assessment or advanced placement. So to say that we don't approve of it, I get that. Joe will call me and say, hey, I got a message from somebody that said we can't do prior learning assessment, or we can't do advanced placement. The answer is that's not the case. You actually can. Where the devil is in the detail. And that is, this is a deliberate process. It's not a refresher course. It's not a continuing education course. But if you've got a registered nurse that's going to fly on a helicopter and needs to go through paramedic certification, or I've got a combat medic that musters out of the special forces and comes back to the US and says, I let that go and now I really want to work in EMS. Or if I've got a board certified EMS physician that wants NRP after their name, there's a lot of different ways that you can go about doing that. And so I think, Joe, really to kind of summarize right here, the reason I think folks may be a little bit skittish or scared about doing it, they don't want to get in trouble. And I recognize that. We want you to do it the right way. But I think it is doable. And it's not going to be one size fits all for everybody. And that's the reason I believe that a lot of people don't want to do it. So when Makara shows up with her stuff, and I'm a nurse and I want to fly on a helicopter, you're going to have a different point of view that you're going to start with, rather than Joe, the board certified EMS physician that comes to me with all my stuff in hand. So I'm going to really have to look at this and tailor it on an individual basis. It's almost like an individualized learning plan. Does that help to kind of start?
I think it's a great start, and I'm sure it's going to raise some questions. But before we do any questions, why don't we just, if it's all right, George, we're going to move over to Bill, get his thoughts on advanced placement from National Registry standpoint, and then you will talk a little bit about it from the state standpoint, and then we'll get into some questions and answers.
Sure. Thanks again, Joe and George, for teeing it up. So in short, the National Registry allows, we permit advanced placement. We don't discourage it. We encourage it. It is a pathway that can be used for, especially for international students, as well as, or international clinicians, I should say, and other healthcare professionals that are wanting to seek national certification at the EMR up through paramedic level. Paramedic obviously requires the involvement with CoA MSP in terms of the advanced placement process. But one point of clarification that I want to offer, and Mark and I were texting back and forth about this, Joe, when you opened it up, we have what's called a re-entry process too, and that is for previously registered EMS clinicians that want to re-enter and become nationally certified again. So that shouldn't necessarily be confused with advanced placement, but the two are two separate processes. So a previously nationally certified EMS clinician that was a paramedic, let it lapse a couple of years ago, there's a process they can go through, continuing education or requirements, and then they can sit for the examination and get their national certification back. That shouldn't be confused with advanced placement. The two are separate. So, so in summary, the National Registry is very supportive of this. The board of directors has reaffirmed this with a resolution a couple years ago, and we work closely with CoA in particular for the paramedic. And yeah, there's full support for that. And Mark, I will turn it over to you to see if there's anything that you need to or you want to add, because Mark is the Chief Certification Officer who is responsible for overseeing that program and all other aspects of certification here at the registry. But Mark, you want to add anything to that?
Sure. Thanks, Bill, and thanks for the great introduction. So with the questions that have been brought up so far, there are two components that might be useful to consider from the National Registry perspective. The first of which is the National Registry does have a re-entry policy for anyone who was previously certified or previously state licensed. That they can do that through that re-entry program, which is available through continuing education. It follows the same recertification standards that someone who is recertifying would perform. So that can be done through the national component, which is sometimes phrased as refresher classes, the same types of things that are used for recertification, as well as then the additional hours for the local and individual component. And we have a process by which then the individual could demonstrate that training, go through the testing requirements, whether that's BLS skills verification and cognitive examination at the EMT level, or whether that's the psychomotor examination and the cognitive examination currently at the paramedic level. And so that covers those who were previously state licensed or nationally certified. And then there do come up circumstances in which someone is applying for national certification, and we do require evidence of course completion. But we do not specify whether that is completion of the entire course or it is a course completion that's achieved through advanced placement or prior learning assessment in conjunction with either state rules or, as applicable, accreditation rules. So there are some of the different components where people can find some guidance on that. Where we've particularly noticed requests for advanced placement options or prior learning assessments have been healthcare practitioners, specifically nurses, physicians, physician assistants have been common ones. There is a pathway if someone is board certified physician in the subspecialty of emergency medical services. Those candidates do directly qualify because when we evaluated the EMS subspecialty domain of knowledge, we were able to demonstrate a complete overlap with the paramedic body of knowledge and scope. With the other physicians and the other groups of that, we were not able to demonstrate that it had a complete overlap, which is why we required the completion of that course completion, but again, encouraging folks to explore advanced placement. The military is another component, but one of the questions is to ask whether or not that military practitioner was previously nationally certified. Different military units also use national certification, and sometimes folks may not realize that they previously held a certification and may qualify for reentry and wouldn't need to complete a full course completion the way someone who wasn't previously nationally registered would have. It can come up with prior students or graduates, including those who graduated from a non-accredited program after January of 2013, that they could then get a new course completion using prior learning assessments, portfolio reviews, and advanced placement to be able to get a course completion certificate from an accredited program. Doesn't come up particularly often, but particularly from states that later adopted accreditation standards, that is an issue that comes up occasionally. Practitioners who were trained outside of the United States can also fall into this circumstance. And there can be circumstances in which programs that are like an apprenticeship or a designated work study program, to where that's combined over time, to where that may be appropriately to use as well. So there may be different ways in which that can be done. There are pathways that can be demonstrated for the training program. There are some cautions to be applied to it. It's not from a National Registry perspective, but just to make sure that your programs are in compliance with the requirements for having an established policy, to where you do have an evaluation of skills. I noticed from looking at the comments, still have to verify skills that are required. There is some expectation within those standards documents that George showed that there would be some assessment of those components, particularly the assessment of terminal competency, as well as some level of evidence of where you have certain skills. But that could also be done through a portfolio review as well, through a structured portfolio review. The key element is have an established policy, have an established practice for that. You are allowed to do, under our, at least from the registry's perspective, we allow that individualized assessment of prior learning, and that may be a useful tool. And then how about those that completed in 2000 for their initial training? The re-entry, if they were previously state licensed or they were previously nationally certified, there is not a time limit on that. So they are able to, if someone was certified from way back when, they could use a re-entry practice. Now, those individuals may want to partner with an initial training program to provide a more robust education, but that is at the discretion of the individual and the training program to design the right program for them. The actual National Registry reentry requirements do not have any restrictions in terms of when that was first earned.
And I also put that for everyone's reference in the chat the link to our website. So feel free to go there if you have any question. I put the paramedic reference on there. Obviously, that's the nature of this conversation today, but the requirements for EMT, EMR, and advanced EMT are also articulated there.
Which is another important point, Bill, from the National Registry's perspective. We're talking about with the paramedic accreditation from the CoA's perspective, but those tools can also be used with the state approval processes to make sure it's done in conjunction with the state at the other levels. That may be useful for EMTs, that may be useful for AEMTs as well.
And speaking on behalf of the state, we would follow the same process that as long as there is an evaluation being done to determine the knowledge of the person and their skills level, and then, meeting wherever the shortfalls are, and then getting a course completion set for the, the exams for the National Registry, and you're good to go. But it's up to each education program to set that up and do that. And the part that I will stress is to have documentation on it. That is going to be the important part here. But I think what I'm hearing from everyone today is that it can be done if you want to do it. I mean, no one says you have to do it, but if you want to do it, there is a process to give people credit for their knowledge and skills that they have had, and shorten the pathway to becoming fully certified again. Does that give anybody any heartburn what I just said, George, Bill, or Mark?
No, no heartburn from me, Joe. I think what I would say is, again, I've been doing this a long time, like many of you that are out there. Some of you are newbies, but some of you are old hands like myself that have been in EMS education for a long time and EMS for a long time. I don't think anybody wants to be the clearinghouse for just pay your fee and get your ticket. That's not what this is about. This really has to have, as I opened up with, some degree of rigor. You are still going to be responsible. Your medical director is going to have to attest to the competency of this graduate. You're signing off on it. So two people that are pretty important, you and your medical director. Your advisory committee really needs to endorse this policy. And you still are going to have to show that rigor through some sort of comprehensive final exam. So the knowledge, skills, and attitudes are still going to have to be assessed. Psychomotor checkoff, they're still going to have to do a capstone experience. And that capstone experience, you get to set that, whatever that's going to be. So if the team leads on an ambulance with a paramedic preceptor is 20, and that's what you're going to put George, the want to be flight nurse on an ambulance, and that's what you're looking for him to do. That's part of that requirement. And back to Joe's point, it has to be documented. That's what we're going to be looking for. I think that's the devil in the detail. You can do this, and I think it's hard. I'll go back to that too. I think it's hard. That's the reason it's a one-off from something that you're already used to doing. And somebody shows up in your office and you go, oh man, I don't know if I could do that or not. That's a lot of work. So if you're willing to do it, the work's worth doing. I think that's my message.
And I think it is worth saying that we did a survey a couple of weeks ago to the education programs here in Texas. 83 of you responded to it, and a 30 of you do offer advanced placement at 1, 2, or all 3 levels. I don't know that. I don't think we asked a question about EMRs, but anyway, at least at the EMT, the advanced EMT, and the paramedic level. McCara, why don't we take a break there? A lot was just said. We just spent 25 minutes. Why don't we do some questions if there is any questions? I'm watching the chat too. I don't see anything over there. But if there's anybody online that would like to ask a question, or McCara, if you have a question.
Yeah, I think Mark and I were texting back and forth. There is a statement on the re-entry pathway that says all candidates for National Registry's National EMS certification at the paramedic level, whose paramedic program began on or after January 1st, 2013, must have successfully completed paramedic education from an accredited program, but it's listed under the re-entry pathway, so it can cause some confusion. It almost reads as if candidates that created or that complete or candidates eligible for reentry must have completed on or after January 1st, 2013, when accreditation became a thing. So Mark was going to address that real quick.
Yeah, that's a great question, Makar, and that does generate some confusion with that. So let me address it in a couple of different ways. First off, if somebody graduated from a program that began on or after January 1, 2013, they can absolutely use the reentry pathway, right? So regardless of whether their program was accredited or non-accredited. If they started their paramedic training program in let's say in January of 2013 from an unaccredited program. Now, almost all of the states had adopted an accreditation requirement by that point. There were a few states that had not, and so there were some graduates who graduated in 2014, 2015 from an unaccredited program. They would need a course completion from an accredited program, but advanced placement can be used in order to get that course completion. So with a combination of a portfolio review, the appropriate assessment of the individual learning, the appropriate review of their experiences, some degree of test outs, the program can design an expedited pathway to get that course completion certificate and then get a new course completion certificate that would satisfy the accreditation requirement and then qualify them for national certification. And it'd be the same process that would be used for any other healthcare practitioner, but that's specific to graduates from an unaccredited program that was after 2013. That's not a common situation, but it does come up from time to time.
And so to clarify, the ones that graduated from a non-accredited program prior to accreditation. So I believe it was Lou that mentioned the year 2000, right?
Yep.
Would they still be eligible for reentry?
They would be eligible for reentry with 60 hours of continuing education, and they would be able to sit for the exams.
Perfect. Thank you. I think that clears that up. And then let's see, there's another question here. Let's see, Jonathan Walker, please clarify what was said. Those that choose the advanced placement pathway must complete a portfolio, or those that chose the reentry pathway?
The reentry pathway does not require a portfolio. I was using that as an example of one of the assessment tools, but George, I don't know if you want to talk about whether the use of a portfolio review. I know that sometimes can get confused with the paramedic portfolio requirement previously from the registry. That's not what I am talking about. I was referring to the personalized learning that George was talking about.
Yeah, I think, again, a portfolio, as mentioned in our policy, really is talking about knowledge and skills gained through that work experience that can be documented. So if I show up on Mark's door with my portfolio of stuff, and then I graduated from paramedic school in 1979, I didn't have an accredited paramedic program. It wasn't accredited. But if I wanted to go through this and I wanted to gain national certification, Mark, how could I do that? That's what I would be showing up with my stuff, that portfolio, and Mark's going to have to feel comfortable that these met certain requirements. And if they didn't, here are the things that, George, you're going to have to do in order to meet our requirements so that I could attest to your competency. Does that kind of make sense, Mark?
Yes.
And I think what you're saying also, George, is no matter how we do this, we need to have strong documentation and approval from the program's medical director and leadership, their board, their CEO, or whoever. We just need that documentation. And when I say that, I'm talking with George at the paramedic level, we expect the same kind of documentation to be available at the other levels, at the state level, when we're going to go in and someone's going to give me credit for, I sit through a third of the hours instead of the full course because of my past experience. As long as the documentation's there, and then they sit for they get a course completion, and then they sit for the exam. We're good with that. This makes a lot of sense to me, especially with the push of people to come back into EMS and into the healthcare system where they might need an EMT, paramedic, advanced EMT card. Wow, that's like a long question there, Makara.
It was. I was providing some copy and paste stuff. So let's see. Okay. Would any of the 30 programs who are already doing advanced placement be willing to share their policies and best practices? I am certain there's somebody out there that's willing to share. We have a great group of educators in Texas that borrow the philosophy that we should never have to reinvent the wheel. So I would just say that if there's any one of you on here that are willing to do that, please reach out to Matt Nealand. And then Lisa was asking about a paramedic who's never held National Registry, but is still licensed in Texas, took a class in 1990 from a college, what options would exist. And that was where I was pointing out reentry pathway, or basically you're eligible for National Registry through essentially the same process.
Yeah, it is a slightly different process, Makar, because you only need the 30 hours national component if you're currently state licensed.
No, there you
Anyone
go.
who is currently state licensed can document the 30-hour refresher course. We would call that as the national component of that, and they would be able to take the exams and they would qualify for national certification.
Awesome. And Lisa, did that answer your question? How is it reentry if they've never been national registered? Oh, okay. And then who would do the skills assessments? So on the just applying for national registry certification, they would still have to do the psychomotor exam while it exists, would be my guess. Correct, Mark?
Yeah, that is correct. They would have to take it for an AEMT or a paramedic. For the EMT or EMR, but I've never seen a reentry argument for EMR. So I think for EMT, we would require a state approved BLS skills assessment. Depending on the individual state that's involved, the foods that's being routed through, then that may involve a different examination that's state sanctioned, or it may be delegated to the program. We follow state rules on those.
All right. I don't see any other questions. Anybody have their hands up that I missed?
I
It's
don't,
not appearing.
wait, I'm on page 2.
I don't see any.
I don't see any hands. We're pretty thorough. I mean, I'm surprised. The other side, let me just remind the people on this call that we had the equivalency process also in Texas. If you took a course out of country or in another environment, and you can go to a program, a college-based program here in Texas, and they could evaluate it and give you a course completion, you sit for the test, and you're good to go also. So we have that process already built into our rules here.
The equivalency, is that what you're talking about, Jeff?
Yes, ma'am. Yes, ma'am.
Yeah. There is a question out of curiosity, how much longer will psychomotor exams be required?
Bill, do you want to address that?
Yeah, I would say we're in the process of doing the ALS redesign, which is specific to the advanced EMT and paramedic. And part of that process is the retiring of our psychomotor exam as we know it today, and replacing it with a performance component portion of the examination that will all be administered through the computer testing that is currently through Pearson and the Pearson Professional Center. So the performance component of the examination is going to focus on clinical judgment. There's a lot out there about that. Again, I encourage you to go to the website to find out more about that. But the timeline of when we are sunsetting the current psychomotor exam and requiring the performance component of the examination is late 2023, early 2024. However, some of the performance component items that focus on clinical judgment will start to appear on exams later this year. And there's a lot of communication and information that has been being shared, certainly at the state and regional and national level. And we will continue to provide that information. If there's any questions, you can look at our website, and as always, you can contact us. But the short answer to the question, late 2023, early 2024 is when the psychomotor exam will be officially retired.
How about a registered nurse that wants to become an EMT to aid her local EMS? Would they qualify for the advanced placement program?
Short answer is yes. And they can work through an accredited program, as we talked about. He has to meet the other criteria, including getting EMT first, and then can sit through and take the portions of the paramedic course that were deemed appropriate to the advanced placement process.
All right, and I believe that answered Sheila's question. Would they be required to obtain their EMT prior to taking paramedic, and I believe Bill just said yes, they would.
Yeah, let me add a little bit to that, Makara, because the requirement from the National Registry perspective is that they complete their EMT certification prior to testing for the paramedic. The National Registry does not have a requirement for training prerequisites. And so it would be possible to design a combined advanced placement program that would cover both the EMT domain of knowledge as well as the paramedic domain of knowledge, and do that in an integrated way. It's just they would need to be certified as an EMT prior to registering for the test. Subtle distinction, but that can be useful for some folks who are interested in combining those elements.
And that would lead to a personal question, since I know you guys are aware of the pilot programs that we've been running in Texas. Are you guys currently working on a combined test, or a test that would combine testing EMT knowledge base as well as paramedic knowledge base?
So we're very familiar with the concept and certainly familiar with what Texas is doing. We have not developed a single exam yet, though. There still are two exams, and very similar to what Mark was saying about as long as they complete the EMT certification prior to sitting for the paramedic test, that's fine. And that would be the same concept that would be done here. The EMT test would be taken in the middle of the program, and then the advanced EMT subsequent to completion of all their other requirements for that. So, but we do not have I call it 0 to hero exam that's developed, and likely won't be developing that for a couple of years, but we are familiar with the pilot. Certainly we support it, look forward to learning from it. And that actually, I think, will be informative to us and to our board if they are looking to have a more comprehensive exam that includes EMT content as well as the advanced EMT or perhaps paramedic content.
Yeah, our early, we're running 2 courses, look at the third. Our early data looks really, really good on this. It makes a whole lot of sense going from 0 to hero, and in a more coordinated fashion. And for the programs that are doing it, they're doing a fantastic job with it.
Yeah. Okay, so I feel like we've asked this one before, but just in case, what if Billy Paramedic completed paramedic program in 1999, has a state certification, but has never held National Registry and wants it now? So all he has to do is take the 30-hour CE and the psychomotor exam. What program would approve the NREMT test cognitive? What program? Oh, I see what he's saying. What program would approve the psychomotor exam and the cognitive exam? How do they go about getting approval to take the tests?
Yes, when they fill out the application, they actually would designate that they're currently a state licensed provider, and then the pathway has that individual communicating their continuing education or refresher training completions directly to the National Registry. Those do not require the paramedic program director approval, the same way somebody who has a course completion certificate would. So it's actually a separate application process within the National Registry.
And then Chris Kern, are the new questions based on any specific curriculum?
Are you talking about our computer adaptive tests or our current exam? Is that what you're referring to?
I believe so. I believe it popped up when you were talking about the redesign of the test.
Yes, so it's based on our practice analysis, which is a reflection of what's actually going on in the field. So the practice analysis looks at 2 things, really: the frequency and a criticality of a skill and or a knowledge topic, or a topic, I should say. And for our frequency, we looked at NEMSIS data for a couple years worth of data to see what the frequency and distribution of calls are and skills. And then using subject matter experts from across, and probably some of you participated in this, we brought those folks together so that we can have an understanding of how significant or how critical some of those skills and or topics are. And then that's how we come up with a practice analysis. So our exam is reflective of that which is happening in the field. And we update that every few years based on, obviously, the dynamic status of pre-hospital medicine. So it's not written to a curriculum or a set of curricula per se. It is written to a practice analysis, which, by the way, to be truthful, nicely aligns with the education standards in terms of topic and content. It's just the weight in which some topics are given vary based on that practice analysis data.
And Chris offered a clarification, no, the soft skills questions. I missed the soft skills.
Yeah, so that was an interesting addition that came to light during the most recent 2019 Advanced Life Support Practice Analysis. So the soft skills are referred to them, including communication, including leadership, and most importantly, the clinical judgment were deemed to be quite important, and actually more important now than in previous exams. And that was a driving force to allow us to further explore clinical judgment and assessment of it through the performance component of the examination. And that actually, the data from the practice analysis was a strong driving force. That's why we are going away from what right now assesses clinical judgment and the integrated out of hospital skill to the performance component of the examination, which is going to better assess clinical judgment and through technology better than what we were able to do 5 or 6 years ago with that technology now that's in place. So yeah.
And then Jane Dinsmore just had a comment on the RN transition. They've had many times, we have had many times, and when they go to the skills sessions, they could not do many common EMT skills. They also had no background in things like TIMS or jurisprudence for EMS operations, hazmat. So be careful. We personally give them the hospital time credits, but make them do the didactic and skills along with EMS rotations. So they had an RN wanting life experience credit for EMT. I could see where that would be a challenge.
And I would just say again, Kara, that, and I agree with Jane, that it really has to be approved by the medical director, the program, the board, that they are getting the skills, the knowledge, and they have the skills and the knowledge to perform the level of that license. And that's what we're looking for. If we're going to come out and look at something, and it sounds to me that's what George is looking at too for advanced placement. It's just, I think, George, you said, and I have to agree with you 100%. We just don't want people being pushed through. This isn't a shortcut, but this is giving people credit for the knowledge they already have. But we got to make sure that they know what they're doing when they get out there. That's for darn sure.
So
the rigor, I think that George was talking about earlier, there's got to be rigor in the process.
Yeah,
it's doable, but there needs to be rigor, not a rubber stamp.
Yep.
So for example, if program A's medic program is 1,200 hours, how many hours, how would they break down the hour awardment or whatever the credit towards advanced placement? Do they, for example, like Texas rule says paramedic program has to be a minimum of 1,200 hours currently. Some programs may be 1,400 hours. Do they have to, in their policy, state that if I believe it was George used the example, they're testing out of trauma emergencies or something like that, and that would generally be 3.5 credits. Does that take those hours away from the program? Does that make any sense? I don't manage a college program, so.
Yeah, Makara, let me jump in there because I think there's a couple nuggets in there that I think are worth talking about. Number one, we don't specify the number of hours that a program has to be. So we got 50 different states like Bill does that they have oversight of, kind of their educational program and looking at that. So Texas, if you set a minimum of 1,000 or 1,200 hours, then it's what it is. My recollection from back in my days in academia in Houston, we put together, we're part of that project of the Workforce Education Course Manual, WECM, WECM. That was done through the Texas Higher Education Coordinating Board. And what that was designed to do was to take workforce programs like us and have a common catalog where it didn't matter if I was in Abilene or Corpus or Beaumont or anywhere else in Texas. And I would be able to say, if I took a 3-semester college course in trauma, it would translate if I moved from place to place to place, so that they don't have to repeat them again. And that's because the coordinating board says we don't want to have to pay for something more than once. So, they want to get students matriculated through an educational program, because those of you that are in colleges know this. You've got to have X number of completers. I believe, at least my recollection was, in a 3-year period, you have to have at least 15 completers, either in a certificate or a degree, in any combination. You have to have 15 completers in order to remain viable. That's how the College Coordinating Board looks at that. So the idea with WECM was to allow portability from student to be able to move if there was a life change, or if they decided, hey, I want to move from one place to the next. So we don't mandate the number of hours. And again, I think that's an important point, but I think that's where program A would have to look at what program B was doing and say, well, you didn't have enough of this, but how about if we gave you our exam, and if you score, I'm going to make this up, but if you score with a 75% or higher, we're going to give you credit for that 3 semester hours. So you would pay a fee, you would take their comprehensive final exam in trauma, and then that would post to the college transcript. That's a way I see that would work.
All right. I'm sorry, I'm looking at some of the other questions that we had. So essentially, is it possible for a program to have an advanced placement policy that includes a written final exam per course, it sounds like, a psychomotor verification, and the hospital field rotations, that they could then issue a course completion certificate that allows the candidate to test for National Registry?
Is that my question?
I believe so. So I
Okay.
would say they would, whatever their policy includes, could it be that, I guess for lack of a better description, simple, they test out of each module, the trauma, the intro to advanced practice, the cardiology, whatever those modules are, complete their hospital field rotations. And let's say it's a nurse that works in the hospital, maybe they get credit for working in the hospital already. And then their psychomotor verification, so maybe the portfolio component to it, and then issue a course completion.
So yeah, I think the short answer to that, Makara, is yes. But again, I'd caution, the devil is in the detail.
Sure.
So if I'm George, the general floor nurse that wants to all of a sudden be a paramedic, that's going to be much different than if I'm in the pediatric intensive care unit and I want to come and I want to go through the paramedic program. But I think the short answer is you got to have an assessment of knowledge, skills, and attitude. It has to be documented. They've got to do that capstone experience. You get to set this, and that's where I think my original comments were. It's an individualized learning assessment. So everybody's going to be different. It can be that simple, I think, but it could also be more rigorous. And I think you need to leave yourself that room in your policy in case you get somebody that shows up and they're a chiropractor. Okay. And this person decides they want to go through and be a paramedic. Well, just because they have a doctor of chiropractic doesn't necessarily translate. Yeah, they're going to be heavy on the assessment or their anatomy and physiology and some of the other courses, but that doesn't necessarily mean that they can operate a stretcher, that they can do CPR, that they can do all the things that we're going to expect them to direct a call, as a paramedic. I think you have to look at each one of those individually.
Sure.
And I just have to add in there, the devil's in the details in the documentation. And I agree with you, George, 100%. The easy answer is yes. You could do just exactly that, but you better have good documentation supporting that. And I'll even take one more step, and I'm not going to play junior lawyer here. I did have a 3-hour business law course back in 1998, but the bottom line is if I push Bill through this class and I just take him on his word and he goes out and kills somebody, will my documentation defend me in court someplace down the road if there's a lawsuit coming down? So it really is, and I'm not trying to discourage people from doing it, because I think it's a great way of doing it. I think it makes a whole lot of sense to me. and it can help reduce the amount of time to get more people into the industry and give them credit for the knowledge they already have. But boy, you got to do the documentation, and you got to have your medical director and your program on board.
All right, so there's another question, and we only have 10 minutes left, guys. No, we went an hour and a half, didn't we? Okay.
We did schedule an hour and a half.
Ooh, okay. So it's Richard says this may not apply to the specific topic of discussion, but does either CoA or National Registry require capstone or a practicum that supports a single preceptor during paramedic clinicals?
Oh, great question.
Yeah,
Go
let me
ahead,
take the first stab at that, George, and then I'm going to pass it
Sure.
over to you.
Okay.
The short answer is, from the National Registry perspective, the National Registry does not have training standards. So the National Registry does not have any specific standards for what training needs to be consisted of or what needs to be components of that. So anything that relates to the training other than the overall course completion is something that falls within the domain of either a combination of the state EMS office, or in the case of paramedic programs, the accreditation standards, which is why I'm trying to introduce that as this is a George question.
Okay, so let me take all of you back. I want you to think way back when you went through paramedic school. How many preceptors did you ride with? I'll bet it was more than one. And I'll bet you had multiple different types of experiences with your preceptor. And some of them were good and some of them were not good. We don't have a specific policy that says Joe must have a single preceptor that he will ride with throughout his capstone experience. But I'll challenge you to think about this. Thinking back on your own educational experience, do you really want to have 50 first dates? Okay. So if I am starting over every single time when I go ride out with Mark, because I was riding with Bill before that, and I was riding with Joe before that, and I was riding with Makara before that, then I'm starting at the beginning every single time. And Mark and Makara and Joe and Bill have to figure out what George knows and what he doesn't know. And that may rise to the top very quickly, where George shows that he doesn't have it together and needs to cook a little bit longer, or it may show that he knows what he's doing and can ramp up pretty quickly. I think from a student perspective, the student doesn't know what they don't know. So if you give them the opportunity to have lots of different experiences, that's great. But I think you need to consider that they're going to be starting fresh every single time they ride out with a new preceptor. I think if you had a handful of preceptors that George could be sent to, depending on the shift and where he was in his education, I think that there's some merit to that. But we don't have a specific policy that says there must only be one or there can only be two. Great question.
All right. Tony points out that when establishing a procedure and policy for advanced standing, it helps to use a faculty member from that discipline to help identify specific curriculum needs. I think that's a great point. And let's see, I don't see that there's anything else.
Anybody have a question that's in the room that wants to put their hand up to ask directly? Let's see.
Say, George, do you know of anybody across the country that really embraces the advanced placement and uses it frequently, right off the top of your head?
Honestly, you guys, I don't know of anybody that does that. I was just looking at this. We did a survey of all of our educational programs back in 2015. So consider the time frame, 7 years ago, prior to COVID. It indicated that 31% of our programs did have a placement of a graduate through advanced placement, but only 18% of those programs had admitted students in the past 5 years. So I think the answer back then, as we were looking at this, was how come we're not doing it? And I'll go back to what I said at the beginning. I think it's because it's hard work. It's a heavy lift for people who are already doing a lot of work. Some of you are single program directors running your educational program, right? I mean, for those of you that are on camera, raise your hand. I'll bet some of you don't have any other help. It's not like the nursing program where they've got 12 different faculty members in the department. So you're doing everything. And I think that's the reason a lot of people don't want to do it or haven't done it. Number one, they're scared. Number two, it's a lot of work. I got to put down everything else that I'm doing, and I got to focus on what what requirements would I have to do for Mark in his particular situation? And that's the reason I think a lot of people don't do it. But man, I think in the climate that we're in today, if you've got people that want to get into the business, and there ought to be a pathway for them to do it. And there is. It's the advanced placement or their prior learning assessment, but it's individual. And that's the reason it takes so long.
And I think keep in mind that people don't consider it as much at the EMT or the advanced EMT level. And I got to say, why not? I mean, I think it is a possibility, and it should be considered. And I'm not looking to just push people out and put butts in trucks, but if there's a way of getting some people through the system, I think it just makes a whole lot of sense. So any more questions? I don't see any. Do you see any, Makara?
I do not.
So we
Nope.
can't get off the phone here. We can't get off this webinar without at least talking about COVID a little bit.
Oh, we could have.
There is no way that's happening. So,
Oh,
I think we have to just talk for a couple minutes on how COVID's impact, CoA, and how it's impacted the registry. And George, I'll turn to you because you shook your head first, and Bill's saying, "Oh my God, don't call me." No.
All right. Well,
we're all thinking, man, we almost got away from having to talk about COVID again.
Well, I'll say Ebola first, so nobody else said that.
Oh, yes, thanks, George.
So yeah, I mean, we were number one, right, in Dallas, right?
Yeah, for
Ebola. So listen, the last 2.5 years they've been brutal, and I think one of the things that I noticed and I learned in my experience of the last 2.5 years was there was a lot of bad, but there was a lot of good. And one of the good things that came out of that was, look, people were wrestling with how are we going to keep the educational pipeline open? Mark was on calls, Bill was on calls, Joe, you were on the SEMSO calls. There was a lot of discussion about COVID and how we were going to be able to keep that pipeline open. I will tell you that we have a statement that's still out on our website right now. Our COVID statement, we extended at our last board meeting through the end of this year. So if you still want to fall within that COVID protocol, we still have the flexibility for you to be able to do that. Okay. Again, there's documentation, devil's in the details, but I think if you're going to exercise that, you can't just simply say, well, COVID shut us down. You're going to have to demonstrate a little bit more about why you couldn't get students, for example, into the hospital. Well, Hospital X is saying in this email, they're not allowing paramedic or any EMS students. They're not allowing anybody's students in there. That's pretty compelling. I think you want to, have documentation, let's say, from your advisory committee and your medical director that kind of supports that. But I'll go back to at the beginning of this, we said we're going to offer maximum flexibility for your educational program, but with maximum flexibility comes maximum accountability. So you, the program director, your physician medical director, your sponsoring organization, college, hospital, fire department, whomever, got to sign on to this, and your state office of EMS have to all say this is good to go. And if you say this is good enough and you're going to sign off on them, we're going to say, okay. If they can't pass the test, well, then that's a whole nother story. You're going to have to answer that question, not just to the state, but to us and probably the registry as well. Why did we flex and they still weren't successful? But I do think that COVID has taught us a lot of things. And Joe, let me mention one other thing. I think one of the things that it did also articulate and really push to the forefront, and this is not just in Texas, this is nationwide. I think the proliferation of a platform such as this with Zoom, y'all have all been Zoomed to death, right? Brady Bunch tiles here, everybody's tired of looking at this. But at the end of the day, it's a way for us to get out into areas that maybe we wouldn't be able to do that. So now, and it's not new to us, but we have satellite campuses across Texas and across the United States. So in previous years or previous iterations of this, you might be less willing to go out into the hinterlands of Texas somewhere, rural, frontier, suburban, or even urban areas that are miles or even thousands of miles away from you or hundreds of miles away from you. Now, with this platform, I think a satellite campus where you might not be able to stand up a paramedic program in Terlingua, okay? Terlingua might have 2 people that want to go through paramedic school, and Lance, I'm going to pick on you because you're out there. I saw you, but just using Lance or one of our other programs around the state, you may be able to say, you know what, I'm going to stand up a satellite campus at that location, and I'm going to help get those 2 people that we need desperately in Terlingua. We're going to get them educated as a paramedic. So I think the satellite is another opportunity for us to be able to be innovative. We're embracing that innovation that people are able to do. But again, I think it comes with some responsibility on all of our part.
From the registry's perspective, I echo a lot of what George said. You know, although the pandemic was horrible and certainly changed the world as we know it, and as we emerge into the new norm, though, of this phase of the pandemic and start to get a glimpse of what the future looks like, I think the benefits of the pandemic, including the Zoom meetings, including a lot of other things related to National Registry, including live remote proctoring that we stood up in 51 days. It normally takes about 6 to 9 months to do that. We did that because there was capacity issues, and we had to make sure that we can get people into the field as quickly as possible. We realized that a lot more that we thought previously is possible, and including the live remote proctoring, the modification to the certification requirements, the social distancing issues related to our psychomotor examination, and the use of provisional certification, which is now over, the recognition of waiving the DE limits for continuing education requirements. All of those requirements were a result of the pandemic, and we don't think that we had any lowering of our standards, but we had some alternatives to getting things done. So that flexibility, that agility from our perspective at the registry, I think helped, and it helped the future for us in terms of we can continue using live remote proctoring, which we are for EMT, and we're starting it for EMR. We can continue to explore better ways to reach out to stakeholders to make sure that, you know, we're on target as we serve you, in this case, the state of Texas, as a certification organization. I mean, the mere fact that I can sit here and talk with you while I'm sitting at a national conference in Indiana, several years ago, this wouldn't have been possible. We would have to get on a plane and come down there and meet with you. But because of the benefits of the pandemic, in particular technology, we do have that advantage. So in terms of the rest of the pandemic, I would just say that, you know, it was very difficult, certainly for us at the National Registry, and but I do feel that we made out very, very good, and we're able to ensure that the pipeline of competent and certified EMS individuals continue to come out. And the fact that our numbers last year broke records yet again, and we're on a trajectory this year for breaking previous established records, including for those certified and recertified, is a positive sign. But there are challenges. The reality is they're not all going to work in the back of an ambulance. They're going somewhere else. So we want to continue partnering, certainly with you in Texas, but the other national organizations in other states, as we look to deal with this workforce shortage, which was exacerbated by the pandemic itself. So I think that's all I'll say for now. But overall, I think the pandemic was horrible, but we were able to navigate it, I think, pretty well, and come out with a lot of positive benefits that we realized in the midst of that pandemic.
And I have to echo what Bill and George have said, and commend the people that are on this call today, because as McCara was having these meetings, like, I guess McCara, in the beginning of the pandemic, we were talking about, well, we were talking every day, but probably about once a month we had a webinar.
Yeah.
And when I think back to that time, and I think of Sheila Elliott on what she did with her basic EMT class of mailing stuff to their homes so they could do skills with their family members on FaceTime and all those kind of things. That was incredible. I mean, the wisdom that went into that and the out of the box thinking is what got us through that, so that we didn't completely collapse to nothing. So I commend everyone for that. Keeping in mind that still in place that we still require that you must touch a patient during your initial education. We opened that door, and I don't see us closing it anytime soon. That it can be in a hospital, it could be in the back of an ambulance, it could be in a nursing home, it could be at a school nurse's office. I mean, all those places where you can touch people, real live patients, to assess what's going on with them, continues on. And for everyone on this phone, on this call from Texas, keep in mind that the staffing waiver is in place until the 26th of August, or, and this is an important or until the governor lists the COVID disaster declaration. And I don't know that we'll get advance notice or not, but you know, I was with the commissioner last week, and I had this discussion with leadership saying, if anyone can give us advance notice on what's going on, it would sure help the confusion out there. So you know, I'll keep my ear to the ground and keep working with our staff here, but I really do want to commend you all for what you did to get us through this and keep the system going, because it took the whole team to make this happen, and it's really been an honor to lead you through this together. George, Bill, McCara, you know, so we're almost 10 after here. Anything else that you want to bring up while we're here today? And the same thing for anyone else on this call when it comes around the education. You know, we've been working with the GTAC Education Committee to redo the rules, try to make it easier, not as confusing. I think you're gonna like what's been done. That'll start later this summer, early fall, as we introduce it formally. But a lot of good work's been going into that. Any other questions, concerns, issues while you have the two best world leaders on education on the phone with us today? I don't say anything. Do you say anything, McCara?
No, quiet bunch. Something's not right. Let's see. Lewis said something about, I don't know if this is brought up, but if an EMS provider expired with dishes, and then the question drops off. Lou, are you asking about the re-entry pathway for someone, or possibly an advanced placement if someone let their Texas certification lapse, and maybe they either also let their national registry lapse, or they never had it to begin with? Is that your question?
I think
There's
it's easier
Lou.
for me to speak if
Yes.
that's all right. We get a lot of people that call me up and say, hey, my state expired and it's been over a year. And I tell them, sorry, the regulations say you got to start all over, day one EMT class. Registry allows you the re-entry.
Yes.
And so it's kind of like there's two separate things. Is there any discussion or any way for them to be able to reobtain their Texas certification without having to start from day one?
Lois, I just have to say, we just
Miss you, Joe.
now are on a way of doing that. It's pretty simple. They can either do equivalency, you know, with that process, or simply go to an education program. I go to Bill's education program and say, look, I expired a year ago. I've got my CE I got my CE up to date, do an evaluation, say, yep, I'll give you a course completion. You sit for the exams and you're good to go again. And so you do not have to sit through a whole new class again, but it's up to the education program. It's going to evaluate your skills, knowledge, and then the end result is they need to get a course completion certificate from that program so that they can test with the National Registry.
But Joe, the National Registry reentry pathway doesn't mention a course completion requirement. It just says
The
60
state
hours
Texas
of
does.
continuing education. So
The state
so
of
they
Texas-
could try reentry, but then they would be diverted back.
So
state?
they could go and get their national registry back and then reapply in Texas to get a license. They could go that route.
Yeah.
Or if they want to come through Texas, we do require them after a year to take a whole new course. As you know, we're going to change that, but that's the requirement in rule right now. But the bottom line is they could go to an education program and be evaluated and give life experience credits or whatever and work with them. So they get a course completion, then go take the test. So they could go either route.
Gotcha. Did that answer it, Lou?
Yeah, it does.
Okay,
And I
good.
just put another question. We have to get a course number for them.
You use existing courses numbers for people to.
Well, I mean, if they're doing like a course through like the advanced placement or equivalency, but if they do the reentry pathway, they wouldn't.
Okay.
If
I was
they're
just
going
going
through
with what
national-
Joe was saying.
If they're going through the National Registry, they do that. But if you're going to do, if you have a course going on, you could include them in that course and use that course number, or you give them a single person course registration number.
All right, perfect. Thank you, Joe.
Sure, my pleasure.
All right, Joe, you got another one. So can any education program do that, say for a basic EMT or advanced EMT, or do they have to do it with a college program only? Lisa, are you referring to equivalency?
Don't use the word equivalency, because that goes, the rule's pretty clear, that goes through a college. But if you, go ahead.
Sorry. So, okay, no, so my question is, let me see how to phrase this. Okay, so Lisa, basic EMT, loses everything in Texas, doesn't have NR, and then wants to come back in. So they can't go through the re-entry with NR because they don't have NR. And now I'm going to bring them back through, and I just do basic and advanced EMT. I don't have an accreditation. So I can get them their basic EMT back without them having to retake the entire course.
You can do an advanced placement in your program, evaluate their skills with documentation. And if you're a medical director for the program and your board approves it, then you give them a course completion. Now they can sit for the exam from the National Registry. But just have documentation on how you evaluate it. Just because Joe Schmider let his certification lapse 2 years ago and I want to come back in, I said, I was 2 years ago. Don't just give me a course completion and say, go take a test, because eventually it's going to get caught. It's going to get caught. We're going to do an audit or something and find it and say, how did you evaluate this person? We're going to want to see some documentation on that.
And,
that
and
help?
Mark,
Yeah. Well,
What?
Brett can tell you that would never happen.
I'm sorry.
Mark,
I said that Brett behind you can tell you that could never happen with me for sure.
I don't-
Lisa,
I
hang
don't
on just a
understand.
second.
Wait,
because I wanna-
Lisa, I don't know what you mean.
That you would come back and do an audit and there wouldn't be documentation.
Okay, thanks.
And if I could get Mark to clarify, because I think maybe there's some misunderstanding on the reentry pathway. Do you have to have National Registry at any point along your career in order to be eligible for reentry pathway?
No, if someone had an expired EMT credential, they would then be able to use the reentry. Even if they were not previously nationally registered, if they had an expired EMT credential, then they would be able to use the reentry pathway.
Thank you. I think many people feel like they had to have had National Registry at some point along the way, and that's not how the reentry pathway rules read on the webpage. So it even says copy of a lapsed state EMT, advanced EMT, or paramedic license / certification if never nationally certified as such. So the reentry pathway is eligible for those that have never held National Registry, for those that may not be aware. Let's see. Generally speaking, George, what is an estimated time frame for the CoA accreditation process?
I don't have a good estimate. Gina, our executive director at KHEP would say, when you give somebody a target from start to finish, people are always going to be disappointed. I think we get kind of banged up a little bit because people think, oh, it takes forever. It might take 18 months. I mean, I've had programs that go 18 months. And everything has to do with the self-study, where it comes in, the site visit, how it gets connected to the findings letter, which, you know, long story short, it's eventually got to go from our board all the way to KHEP's board. So there's all these different dates that are taking place. So I would say, you know, if you're in that process, and I don't know where the question was coming from, or who that was, if it's an LOR program moving to initial accreditation, if you've kind of already gone through that, the next step is, you know, we're with an LOR program, we're kind of giving them a faster pathway, if you will, you know, clearance to get into a schedule so that we can get them visited. But we're dealing with COVID. So, you know, putting people back in the field has been a challenge. So, you know, I don't want to say it will be 18 months, but I don't want to say it could be 6 months. I would just say it's not going to be quick, but I'm happy to talk with you offline if you want to give me a call directly, and I'm happy to talk about your particular situation.
And then Matt requested, could dishes and or in our EMT create an algorithm that we could share with people contacting us with questions about advanced placement / expired certifications. For example, something like an ACLS flow chart would be great. And I would say if you want to draft something, they'd probably be happy to edit it for you.
I like the way you think, Makara.
I'll let y'all answer that though. That was just my thought.
No, I think from the registry side, we don't have a flow chart that's written for that right now. We can take a look at developing something, or Matt, we'd love to see your draft of it.
Yeah, he says he'll do
And
the legwork. I like it.
that sounds awesome. Be happy to vet it. So if I were looking at this as like an algorithm flow, what we do is we build the steps through a series of questions in the application. And so one of the questions that comes up first, if you have a candidate that says, I have things that are expired, I'd like to know, you know, what do I do to get them back, right? And so if you were looking at that from a reentry, the key question is, number one, is the person still Texas certified if they're national registry, if they want to get national registry? If they are currently state licensed or state certified, recognizing that those terms are sometimes used interchangeably, then they need 30 hours of continuing education, take the tests, and they will become nationally certified. If they were previously nationally registered, or they were previously state certified, then they take 60 hours of continuing education, they take the tests, 60 hours, I'm sorry, for paramedics. For EMTs, it's 40 hours. For AMTs, it's 50 hours. Sorry, should have been more specific with the different levels. Then they take the tests and they will be ready to go. And then and so really those are the two-step key questions for that. If they were never state certified or they were never nationally registered, then in those cases, it may be appropriate for advanced placement, depending on the program director's review of their individual circumstances. And that's a program decision of how they do that.
Cool. Any other questions? Let me see. George asked that. Matt, we're holding you to that flow chart. Just want you to know that.
I know. And I hate to put it off on you, but I just know how busy these guys are. And so if you want it done, I think it's just going to be faster if you were to help and let them edit versus waiting on them to start from scratch and create something. So that's why I tossed that out there. But George, there's an email chat or there's something in the chat specifically for you with an email.
I would ask Richard to shoot me an email. I'm sorry, I'm not scribing this and I'm not saving it. So if you could shoot me an email, I'm happy, or call me. I'm happy to talk with you about the process.
All right.
And Bill's trying to help you out there, George. Any other questions today about anything to do? We have, as I said, we have George here from CoA, we have Bill from the registry, we have Mark, we have the experts here. Any other questions you want to ask us? We have 10 minutes before we're done here, or we can quit.
How do the individuals seeking NR certification who are already state certified receive a PATT, a psychomotor test? So I'll let Mark answer that. I think it was covered earlier, but.
Yeah, they should be able to complete the application indicating that they are currently state licensed as a paramedic. If there's any problems with that, then you can let us know. And I'm going to put the general support email at support@nremt.org. And I would encourage anyone who is having problems, concerns, general issues, the email address that will get you probably the quickest, most reliable answer is support@nremt.org. What that is that's a help desk system that we can then route to the appropriate specialist within the National Registry to be able to get you an answer. It's our customer experience team that does the initial flow on that. They can either provide some direct feedback, but they can also route it from there. But that also allows us to keep track of everything. And I was just going through that with someone. I am 90% sure that's going to get you a PAT. If there's any problems, feel free. I put my email address in the chat. Give me a buzz and we'll figure it out.
Mark, did you want to give us your cell number? Just kidding.
Yeah,
Just
I'd be
kidding.
happy to do that. Yeah, exactly.
Just kidding. Just kidding. Any last minute questions? While we're waiting for that, anyone else from the state office that on, please turn on your camera. I see Maddie is on, and y'all can see Brett's right behind me. When he moves forward, he's focused. When he's not, he's out of focus. I can't see all the screens. I guess
I thought I saw Jaime
I
was
thought I
on.
saw Jaime too at one time. But anyway, these are the people in the office here that are here to help you. We are a part of your system, and we stand ready to support you through whatever issues you might have. So don't hesitate to give us a call, drop us an email, or whatever the case may be, because we really are here for you. With that, unless there's another question.
I don't believe so. There was, somebody asked for George's email address and I found it on the website and posted it. So
That's
you're
on the
welcome,
website.
George.
Yep, you're welcome. Thanks. Sorry. Someone monitored in the chat.
I didn't post your cell phone number, so you're welcome.
Well, my cell phone number is 911. So anytime they want to call, somebody will answer and they will show up. I can promise you that.
Remember, we're on a recorded line here.
It's all right.
He was just kidding. He was
Just kidding.
So real quick, any news, any new things happening with CoA or with National Registry?
Yeah, we're accepting site visitor applications through May the 1st. If you're in an accredited program and you're interested, you can go through the process. It's posted out on the website. We're doing virtual site visits, trying to catch up, but that's underway. Annual reports, if you're an accredited or you're a program with us, are due May the 15th. There's an update working through the KHEP system for the standards to be updated. Student minimum competencies, that's the old Appendix G. Mark and Mark at the registry and the folks at the registry have been working closely with our team. We're looking for programs to implement that starting January 1 of 2023. Lots of webinars that are out there posted on the website. So if you want to know something, it's out there. And if not, give us a shout. And then we have an all accreditation conference in Louisville, Kentucky. We're actually going to be live this year, face-to-face, June 1st through the 5th. So if you're interested, it's out on the website. That's what we got.
From the registry perspective, we're continuing to work on our ALS redesign, as I alluded to a little bit earlier. Very excited about that, and that's continuing to progress. Go to our website, and you can just search for ALS redesign, and you can find the latest on that. Equally exciting is our continued competency initiative, which is actually led by Mark, and that is really ultimately going to be creating an agenda for the future as it relates to continued competency and continuing education. But it's, challenging us to think of new ways of ensuring competency beyond the traditional continuing education role and model. So it's aligning with emerging and best practices throughout the testing and certification industry. And it's really, I feel, very exciting. It's going to be of great benefit, significant increase, I think, in the value of certification and the products that are going to be available to EMS clinicians, to state offices, to educators. So very exciting stuff with the ALS redesign, super exciting stuff with the continued competency initiatives, and both of which can be found on our website with regard to the latest updates on that.
Thank you, guys. And then Joe, this last one's for you and George. How could our program request information about the abbreviated program that Weatherford College is using that bypasses EMT course when going through paramedic? And does CoA have any comments on those types of pilot programs?
So let me take it first, George. We're not bypassing an EMT course. We're including it in with the paramedic course. And they still do take an EMT test before they take the paramedic test. So it's just a reformatting of the education, but both are still required. It's been a pilot program in Texas. We've had 2, and I think we're looking at a 3rd one now, right, Makara?
Yes. Well,
And-
there's a 3rd one going from Del Mar is doing a 2nd class, but we also are looking at a 3rd program starting. So.
So it still does meet all the requirements by rule in Texas, and it works really well. It's been very successful. George, I don't know if you want to add anything to it.
Yeah, I think from our perspective, as I'll restate what I said earlier, and that is that we would support innovative approaches to education. I don't think there's anything that prohibits you from delivering that in the format that you're talking about. So if the state's good with it, the registry is good with it. I mean, I think you want to see what are the outcomes, and if the outcomes are good and people are passing. I saw that presentation that Jeff and Melissa had at the Education Summit. It sounds very, very promising, and I think that's an innovative approach to education. So we'll see. I'm excited to see.
We're just kind of used to leading the way here in Texas. So what can I say?
That's how we roll.
That's right. Okay, with that, I'm going to say thank you, George, for your time this afternoon and your participation. As always, a friend and a colleague. The same to you, Bill. Thank you very much. And Makara, your leadership has been incredible and continues to be. And to all of you, thank you for your commitment to the Texas EMS system. And with that, we will bring this to an end. Say, have a safe day. Be safe out there, and see you down the road somewhere. Bye now.
See y'all.
Bye, y'all.
Everybody.